So the prevalence of children's mental health issues in the United States is about 1 in 6 children. 1 in 6 children usually in the United States are struggling with a behavior, emotional, or a developmental mental health disorder. Some things that could cause mental health issues in children are environmental stressors such as neglect and abuse. Other mental health issues are hereditary and can be inherited from parents or grandparents, or they could just be from our genes, genealogical. Another thing that could cause mental health issues in children is trauma. So those are the things that we see most often that cause these issues mental health issues within children. ACEs are adverse childhood experiences that we would consider out of the normal development for a child. Some ACEs could include trauma, neglect or abuse, the loss of a loved one or separation of your parents. Some other ACEs can include if the child's parents themselves deal with a mental health issue or issues with addiction. So ACEs would be anything that's outside of what you would consider normal development for a child. So mental health disorders can affect children. It can affect the way they behave within the home setting or within a school setting. It can impact the way they learn, whether they're distracted or whether they cannot focus. And it could also impact their emotions and their ability to regulate their emotions. So we try to focus on helping children regulate their emotions. The most common disorders that children have are ADHD, which is attention deficit hyperactive disorder, anxiety, depression, or other behavioral or mood disorders. So some things that we see can improve mental health in children are love and acceptance first and foremost by parents. So being able to get onto the level with your children and see what they're struggling with, see what they're dealing with, and see how we can help them the most. Other things that parents can do to help their children are have some kind of routine with their children, making sure that they have time for bed, that they have time for homework, that they have a specific time for each of these things so these children know what to expect, so your children know how to manage their day. The other thing that's really important for children are having rules. So having some kind of rules and structure to your home environment is also important and helps children thrive within their environment. So some positive parenting techniques that we commonly see helpful for children are positive reinforcement, positive words, using things such as timeout versus physical punishment or corporal punishment. One thing that parents could look out for if they're concerned with a child's mental health, if they have a mental health concern, is 3 things. The first thing is the child's behavior. So if you notice that your child is isolating more, is not acting like themselves, is being more closed off or not as open as they used to be, that is one big thing that parents can do in order to kind of identify these issues. Another thing that parents can take a look at is their grades. So we notice that when children start to have these issues with mental health, that their grades will slip and the children aren't paying as much attention to school as they used to due to these kind of symptoms that they're feeling. The other thing is their sleep pattern. So if you notice that your child is sleeping way more or way less, that is another indication that something is probably going on. So those are the 3 things that I think would be most important as a parent to look out for your child. So if you feel as a parent like you have tried several things and you have seen no improvement with your child, it might be worthwhile to talk to a mental health counselor to see if there's any other techniques that maybe we could assist you with. The other thing is maybe talking to a physician or to your primary care doctor to come up with a treatment plan that you feel works best for you and your child. Thank you so much for watching this video. If you feel like anything identified with you throughout this video, please feel free to give us a call so you can make an appointment. Come chat with us. We'd love to talk. Thank you so much.